Hello, my name is Julie Hides. I work at Griffith University and my background is in physiotherapy. Today I would like to present to you some of the parallels that we have observed between musculoskeletal reconditioning of astronauts and conditions that we see in terrestrial populations here on Earth. One terrestrial problem that we see a lot of on Earth is low back pain. And interestingly, low back pain is also troublesome for astronauts. So exposure to microgravity has been associated with back pain in astronauts, and the prevalence in fact is higher in astronauts than in terrestrial populations. We don't have a lot of astronauts to study, so a lot of our information has been gleaned from analogue studies, and a good example of analogue studies that have been used consistently is bedrest studies, where people are put to bed for 60 days, head down, not allowed to get up. And we can study things such as the effects on the musculoskeletal system and whether they develop low back pain. And when prolonged bed rest participants and astronauts have been compared, the astronauts actually reported greater intensity of their low back pain. And interestingly, astronauts with a history of low back pain more consistently developed low back pain in flight. One area of research that we know quite a lot about from people on Earth is the relationship between back pain and paraspinal muscles. It's quite interesting that people with low back pain consistently have been shown to have smaller muscles. The muscle size can be predictive of people who will get pain, especially in males. And people with disability, high levels of disability, also have smaller muscles. This is relevant to physiotherapists because if we can identify deficits in muscles, we can then work out ways to rehabilitate muscles, improve motor control, and improve muscle size. There is good evidence that exercise is an effective approach for people with low back pain on Earth. Some of the pictures in this slide are the motor control training approach, which teaches people how to use the muscles of their core, if you like, their abdominal and back muscles. You can see in some of the pictures people getting feedback from ultrasound imaging so they can learn to control their muscles with visual feedback. It's also related to controlling the curves in your spine so that we can distribute force as well. And dissociation of movement, making sure that people can move well from areas above and below the lumbar spine. In collaboration with the MADA Hospital in Brisbane, we've examined a lot of people with low back pain and tried to determine if we could actually predict who would respond best to exercise interventions. And in this study, we looked at how well different patients presenting with low back pain could control their muscles. And the results showed that the people that had poor control of their muscles responded better to exercise therapy. So in other words, if we can identify specific deficits in muscles and target our interventions into improving control of those muscles, this is a good step forward for us to be able to determine which patients will respond the best to exercise. So what happens to these important muscles of the spine in our astronauts when people are exposed to microgravity? And you can see from the picture in the middle here that posture is changed dramatically when we are not exposed to gravity. It's quite a flexed posture. If you'd like to think of what this could be similar to on Earth, the most similar situation would be swimming underwater. So you can see that you can lose your spinal curves, and if you think of swimming underwater, which muscles you would use, you're predominantly using your flexor muscles, not your extensor muscles. And there's been some really nice studies that have demonstrated the effects of microgravity on the intrinsic muscles of the spine. Another analogue for microgravity that I'm sure you're aware of are parabolic flights, where people in the plane are temporarily exposed to decreased gravitational forces. Through collaborations with Nick Kaplan and Enrico Di Martino from Northumbria University in the UK and funded by the UK Space Agency, we've been very fortunate to be able to examine the effects of temporary decreased gravitational loading on the intrinsic muscles of the spine. Without going into too much detail about what this the results for individual muscles showed in this study, the interesting thing I'd like you to observe from this is that even very temporary decreases in gravitational loading affect the spinal muscles and affect them quickly. So this leads us to understand why microgravity and being, say, on the International Space Station for 6 months has such dramatic effects on especially anti-gravity muscles and your extensor muscles. We have also looked at the effect of prolonged bed rest on specific muscles of the spine, and there's been quite a comprehensive body of work now examining the effects of bed rest on individual muscles, and that we know, similar to the parabolic flight studies, that once gravitational loading is removed from the human body, you'll have quite specific effects in different muscles. And it might be intuitive to think, oh well, if you put someone into bed for 60 days, all their muscles will waste because they're not using them. And the same for space. Maybe all their muscles will get smaller. And in fact, this is not true. There are far more dramatic effects on specific muscles than others. And in fact, some muscles actually like bed rest and like space and get bigger, whereas others will get smaller. And the lumbar multifidus, the deep intrinsic muscle of the spine that I've already mentioned to you, is affected dramatically quickly by being put to bed or by going into space. The image you can see on your screen is a magnetic resonance image of a bed rest participant at the start of bed rest, and we're looking at the paraspinal muscles and the psoas muscles in this slide. So this is at the start of bed rest. This image shows you the same participant at the end of bed rest, and the multifidus muscle, the muscle close to the spinous process in this image, has decreased in size during the bed rest period, whereas other muscles such as the psoas, iliopsoas, have not decreased at all. So this is this specific effect of bed rest or microgravity on individual muscles. This slide shows you some of the results from prolonged bed rest studies, and these were the Berlin bed rest studies. You can see on the y-axis the 0 represents where a muscle can either be above the line or increase in size, or below the line and decrease in size, and this is representative of percentage change. The muscles on here are the quadratus lumborum, erectus spinae, multifidus, the abdominal muscles, the psoas, and the rectus abdominis. So you can see from the image on the left that the multifidus muscle and erectus spinae muscles go down significantly in bed rest, while on the image on the right, the abdominals and the psoas and the rectus abdominis muscles go up in size. And interestingly, this does represent a very similar situation to what we see in our astronauts. This again is an image showing results from the bed rest studies, the Berlin bed rest studies, but again, you're seeing a percentage change, and this slide is only representing what happened to the multifidus muscle. And what I would like you to note is, if you look on the x-axis, you've got BR is the time of bed rest, and then R is the time of recovery. So you might think it would be intuitive that if you got put into bed and took gravity away from the muscles that respond to gravity, the muscles would get smaller. But when you get up and get going again and are exposed to gravity again, they'll just come back. And this would be a reasonable assumption. However, it's not true. And you can see that at 90 days post reambulation and exposure to normal activities, the muscles were still significantly smaller. So this is really interesting information for us. It means that if we actually change the environment for the muscles and then re-expose people to gravity, that they might need to do specific things to actually get these muscles back. And your body will be quite opportunistic and maybe select other muscles for the job if certain muscles aren't responding well. The most recent bed rest study that I have been a collaborator on was held in the NVHAB in Cologne in collaboration with Professor Nick Kaplan from Northumbria University. The intervention used during bed rest was a centrifuge. Here you can see a participant actually on the centrifuge. So they're transferred from the bed, they slide across onto the apparatus so they don't stand up and be exposed to gravity. And this intervention was used during the bedrest study. So there were some participants who had the intervention, and then the control participants were not exposed to the centrifuge. This study used magnetic resonance imaging to look at the size of muscles and also investigate the lordosis and the discs in the bedrest participants. And results from the control group showed that, in line with previous studies, the deep back muscles of the spine, the lumbar multifidus, decreased in size. The lordosis actually flattened, and this has been reported in studies on astronauts as well as previous bedrest studies. A Dixon sequence was used in the magnetic resonance imaging, so that this enabled us not just to look at muscle size, but to look at fatty infiltration or change in muscle structure in the participants exposed to prolonged bed rest. And the results of this were very interesting. The fatty infiltration seems to be more localized to the deep ventromedial corner of the multifidus, and it seems to be very related to where the muscle attaches to bone. This is one of the participants from the bed rest study being tested by Enrico. What I'd like you to notice, that you can see him sitting there. The lordosis is, you can see just using visual inspection, that his low back is very flat after lying in bed for 60 days. So there are effects on the spinal structures as well as on the muscles. So one of the challenges for us as physiotherapists is, can we actually regain that normal configuration of the spine with a lordosis and a kyphosis, as well as regain the muscles that control those curves? This is really important for axial loading and force distribution, and it's been shown to be very effective in low back pain populations in decreasing pain and disability. In the picture on the left, you can see Gunda Lambrecht, who was the physiotherapist for ESA for many years and has reconditioned the astronauts when they come back from space. So together with Gunda's extensive knowledge of astronaut pre and post-exposure rehabilitation and my work in Australia on low back pain, we came together to develop a program to try and optimize rehabilitation or reconditioning following exposure to the analogue of bed rest studies, to try and help inform the astronaut rehab program as well. So Gunda's work, you can see her in the picture on the left there. She works in conditioning prehab for the astronauts going into space. She's still in communication with them when the astronauts are on the International Space Station, and then of course conducts rehabilitation with them when they come back to Earth. And in this picture on the left, she's in Cologne at the European Astronaut Centre. Via live link, she can watch the astronauts doing their exercises and correct how they do them. So she can give them verbal feedback. And this is really important because the muscles in space, the proprioceptors in muscles like the multifidus, which control the curve of your spine, you can't feel where you are in space nearly as well as you can on Earth. And of course, we're trying to load the muscles and the bones to decrease the atrophy that occurs in space. And if you load heavily in a poor position, just as you would know on Earth, you can actually injure yourself. So precision, form, good performance of exercises in space is really important. The little graph at the bottom shows that muscles go down in space in size, and this is again the lumbar multifidus, and then they can be regained using reconditioning once the astronaut comes back to Earth. We've recently conducted an investigation and published results from 6 astronauts who spent 6 months on the International Space Station. And this was looking at Gunda's work in collaboration with Nora Peterson, who's a sports scientist, how they prepared astronauts, what happened once they came back from space, and could they be reconditioned to their pre-exposure status. And you can see the picture on the left, which is the ARAD, Advanced Resisted Exercise Device. So the astronauts are trained on this on Earth before they go into space. And you can see the picture in the middle on the bottom is someone actually on the ARAD, which can be configured to work different muscles, so upper limb, lower limb. And this is the device the astronauts are training on when they're in that live video link with Gunda. So if they're sticking their chin out too far or they're rolling their hips back, she can give them that audio instruction to try and correct their technique. The picture at the top is of the treadmill, and of course it's not just strength and atrophy of muscles and atrophy and effects of decreased bone density. It's really important for the astronauts to maintain their cardiovascular fitness as well. So here are some of the results of this study, and this is showing the cross-sectional area of the multifidus muscle at different levels over time. And the red dashed line in each one of these little graphs indicates the mean pre-flight measure. And this is very interesting because it showed that the effects of exercise on the ARAD were different for different vertebral levels. And the bottom right-hand corner shows you the multifidus at L5 at the base of the spine, and it lost the most size. If you look on the x-axis, that's R+1, recovery first day, R+8, R+15 days of recovery. So 15 days of working daily with the astronauts was enough to start restoring this size. But the effect is not the same on every vertebral level. And in fact, if you look at the top left, the L2 cross-sectional area, exercise on the ARAD maintained that muscle. So we see different effects of microgravity on different levels of the spine. And this is very much in line with what we see in studies of people with low back pain on Earth. The L5 level is the one that is the most affected, and often where we have to really target our rehab to try and improve it. So what are the parallels between people exposed to bed rest, microgravity, and people here on Earth with low back pain? Well, there are many, but I suppose the primary take-home message is that muscles are affected differently in different situations. And for physiotherapists, we need to be able to detect which muscles actually are not working well in order to provide really specific and targeted programs to actually enhance or regain control and size of muscles. And this is equally important for all of these groups. What is really nice from a rehab perspective is that astronauts represent a group of really healthy individuals that we know we can expose them to microgravity. They will have predictable effects on their muscles, and we can trial different intervention approaches on them, which is usually in the absence of pathology. So that's really useful. If we think of parallels between astronauts and terrestrial patients, there are many parallels. Think of all the poor patients with COVID at the moment that are ventilated for a terribly long period of time and then need to go through rehabilitation. So we can learn from techniques that have been developed with people exposed to microgravity, or conversely with rehab of neurological patients or people that have been exposed to prolonged ventilation. How can that help us devise exercises? And this might be super important when you consider long duration missions. This will be a different situation for us because they won't have exposure to things like the ARAD because it's too big to go on those long duration missions. So maybe some of those intensive care rehab post conditions like Guillain-Barré, for example, or maybe long COVID, we'll actually be able to take some information from what we've learnt with neuro patients and apply that to long duration flight. And there are probably many other conditions that we can really find that nice reciprocal knowledge transfer from microgravity studies, analog studies such as bedrest, and our human populations on Earth. Other conditions you could think of: osteoporosis, so think of astronauts and that decreased load on their bones. Osteoarthritis. There are many conditions which we could do some really useful research and benefit from studies on people exposed to microgravity. So in conclusion, I do think it actually is a reciprocal knowledge transfer between information we've gained from analog studies, space studies, and studies of people on Earth, Our key message, of course, is around exercise therapy, and I hope I've been able to give you a little bit of information or a little bit of insight into why we think targeted and focused exercise programs are really important. Also, how important gravitational loading is to how we function on Earth as humans, and how we're going to cope with that in long duration missions. The effects on the human musculoskeletal system will remain a challenge. Lastly, I'd like to acknowledge the other researchers that have contributed to this work. I've been very lucky to work in a great team of researchers, and hope to continue doing this work in the future. Thank you for listening.